Hello, I'm Dr. David Green, CEO of the California Pain Network. The topic today is 5 things to know about epidural steroid injections. They were first performed in the 1950s, so it's been over 60 years of their use in pain management. Their purpose is to relieve the pain from pinched nerves in the spine. This could be from spinal stenosis or herniated disc. They're most commonly performed with cortisone. There have been dozens of studies looking at use of cortisone and the different types. That's their most common medication. The indications are the first thing to know. So one is if you have a herniated disc with sciatica. Here you see a disc. Normally it's akin to a jelly donut, a soft inner portion and then a harder outer. If you get a tear in the harder outer part, the inner jelly can squeeze out and pinch a nerve root nearby. You see the redness, that denotes inflammation, and you get sciatica. Okay. The second indication would be for spinal stenosis, which is where you have arthritis overgrowing around the spine, soft tissue and the bones, and that can pinch on nerve roots as well. An additional indication would be, let's say you had a degeneration of this disc, but you didn't have this herniation, okay? But you just had a tear or multiple tears in this outer part, and that was sparking up inflammation, and those inflammatory chemicals were irritating the nerve root. You can actually get sciatica from just a chemical irritation, and that can be helped with an epidural steroid injection. The second thing to know is how they work. Cortisone is a hefty anti-inflammatory. So you have the inflammation around the nerve root here. The cortisone is put in this area, and essentially what you end up with is a soothing bath of steroid medication. Okay? It doesn't fix this, it just kind of soothes the area and provides pain relief. So it's not curative, but it's a great band-aid. And it can stick around for weeks to months, and it slowly dissolves, and as it dissolves, the pain relief may go away, and it can eventually be repeated. There are now 3 different types of epidural steroid injections. The first that was invented back in the 1950s is called interlaminar. That's the easiest. A lot of doctors used to do it actually without x-ray guidance. This device here is called a C-arm. See how it looks like a C? But that gives you a real-time x-ray where the doctor looks at it on the screen so they can see where the needle's actually going for the epidural. The second one was called a transforaminal. That's the most recent type that was invented, and that puts the needle very close to the exact nerve root compression. A caudal is different. The needle actually goes in down here near the buttock area or the sacrum. It actually goes up and delivers a larger volume of steroid, so it can by gravity migrate into the various areas and cover a region that involves multiple nerve roots, such as with spinal stenosis. Here's an interlaminar. The needle goes into the back area, straight through between the lamina. Here's a lamina, here's a lamina, okay? And it delivers the steroid medication right in the back there and seeps over to wherever the nerve is being compressed at that level, okay? Here's a transforaminal. As you can see, the needle doesn't go right through the back part. It actually goes off to the side and delivers the steroid medication right close to where the pinching is occurring. And the third is called a caudal. It goes way low, all right? This is the sacral hiatus, okay? Delivers a large amount of steroid and numbing medicine, and that migrates up and can go to either side and give pain relief. Fourth thing to know is what are the outcomes of epidural steroid injection. There have been dozens of studies performed in the last couple of decades looking at these. Overall, 75% of patients receive good to excellent outcomes. There's some studies that show 90%, some studies that show 50%. Overall, it's 75%. To be a good study, it should include randomization, so some get a sham injection, others get epidural, and the use of x-ray guidance, which you saw earlier, the fluoroscopy. Studies that don't include fluoroscopy are no good, all right? Because studies show that if you don't use fluoroscopy, up to 40% of the medication may be put in the wrong position. A prospective study of patients with radicular pain, meaning pain, sciatica for instance, caused by degenerative lumbar spinal stenosis, found that after transforaminal epidural injections, 75% of patients noted at least a 50% reduction in pain scores, and almost 2/3 had improved ability to walk, and 57% had improved standing tolerance at a year. All right? So this injections, transfemoral, lasted for a year. Very good outcomes. The fifth thing to note is that epidural injections are not FDA approved. All right, they've been done for 60 years. Why are they not FDA approved? You know why? Because a lot of medications, 40% of them that are used are not used on label. They're used off label for an indication they were not originally approved for. The physician deems them appropriate for that, and that is not a bad thing. Lots of treatments work very well for indications that they were not initially approved for. So it's not a big deal. People say, oh, they're not FDA approved, that means that they're terrible. That's not the case at all. Bottom line is that epidural steroid injections are an effective treatment for pinched nerve conditions. They're outpatient, they have a very, very low complication rate, and they may be given as a series of 3 injections over 6 weeks, or they can be repeated every few months as well. The California Pain Network offers the top non-operative pain management all the way from San Diego up to Oceanside, Orange County, LA, Bakersfield, San Francisco, Inland Empire. Over 50 insurances are accepted at the various clinics with over 25 treatment options available, including obviously epidural steroid injections. The clinics have over 90% success rates that we're affiliated with. They have board certified award-winning pain management doctors. Call today 877-877-8556 and visit us online at californiapainnetwork.com. I'm Dr. David Green with the California Pain Network. Your pain stops here.